So pulpitis means inflammation of the dental pulp, and there are four types of pulpitis. First one is acute pulpitis. Second one is chronic pulpitis, and third one is open pulpitis. Yes, and the fourth one is closed pulpitis. Okay, so basically the acute pulpitis is sudden and it's an active inflammation. So it happens suddenly and it is a active inflammation. Second one, which is chronic pulpitis, it is long standing and slow inflammation. And the third one is pulp exposed to oral cavity, that is open pulpitis. Exposed to oral cavity. And fourth one is closed pulpitis, pulp not openly exposed. Pulp not openly exposed. Okay, so this means chronic closed pulpitis means in long-term inflammation, but the pulp chamber is still relatively closed. What are the causes of closed pulpitis? So the causes for the closed pulpitis will be deep caries. Most of the patient will find deep caries in their oral cavity, and repeated restoration can be found. And next is cracked tooth. Patient who is having cracked tooth, depends upon what kind of fracture it is, they will be seen cracked tooth in there or in the teeth. And micro leakage, that means poor restoration seal allow bacteria and toxins, that is for the filling. Micro leakage will be found. Low grade chronic irritation, that is due to trauma. And the last one is thermal or chemical irritation. Thermal or chemical irritation. So if we will look into the histology of this, predominantly mononuclear cell infiltrate with a vigorous connective tissue reaction we can see. That means in chronic inflammation, the main cells involved are lymphocytes. We can see plasma cells will be seen, and macrophages will be seen. So their role, what will be their role? Like if lymphocytes are present, what are their roles? Mostly the roles will be like for lymphocytes will be immune response, and plasma cell should be antibody production, and macrophages will be phagocytosis and chronic inflammation control. chronic inflammation control. So these are the cells that has been present and their roles. So all these cells are mononuclear cells. If we look into these cells, these are all mononuclear cells. Okay. The pulp also show connective tissue reaction, meaning the presence of fibroblast activity. Fibroblast activity can be seen. Collagen deposition can be seen. Fibrosis will be seen. New blood vessels will be seen. That cause attempt of repair. So these are the connective tissue reaction that we can see. Okay. So the main thing is, what is pulpitis? Pulpitis is the inflammation of the dental pulp. What are the types and meaning? There are like 4 types of pulpitis. First is acute pulpitis, chronic pulpitis, open pulpitis, and closed pulpitis. Acute pulpitis causes sudden acute active inflammation. Chronic pulpitis is a long-standing slow inflammation. Open pulpitis will be pulp exposed to oral cavity. Closed, as it named as it is, it will be closed and not open to the oral cavity. What are the causes? Main causes will be dental caries, repeated restoration, cracked tooth, microleakage, trauma, thermal or chemical reactions. What are the cells involved in it? The first cell will be lymphocytes. Second one is plasma cells and macrophages. Lymphocytes mostly do the immune response. Plasma cells do antibody production. Macrophages does phagocytosis and chronic inflammatory control. Along with this, we can see the connective tissue reaction, which is the presence of fibroblast activity, collagen deposition, fibrosis, and new blood vessels attempted repair. Okay.